The exciting thing about this in my mind was the fact that we had a model of the patient's heart to then plan the procedure in detail and to actually practice putting a stent in here to see how it would behave, and then to use that information then to go and treat the patient in the cath lab.
I think it's very useful, especially for the patient who have a very complex anatomy, like this aneurysm, and we think it's in the future we can utilize this modality for other patients as well.
So this is an exact model of the patient's heart, and you can see the aorta here with this large aneurysm here that is abnormal. So one option to take care of this would be a surgical option, which carries with it some additional risk. So what we decided to do was to treat this area with a stent.
In that sense, we practice actual procedure prior to the actual patient case.
Children's Hospital of Michigan is a great place to send patients with complex problems that we then use state-of-the-art techniques to help treat.